Welcome to this video on chronic disease epidemiology based on Chapter 11 of Introduction to Epidemiology by Merrill. While much of epidemiology began with infectious disease, today the leading causes of death and disability in many countries are chronic diseases. These are long-lasting, often incurable conditions that can be prevented or managed through public health approaches. What are chronic diseases? Chronic diseases are characterized by long duration, slow progression, often no definitive cure. Examples include heart disease, stroke, cancer, diabetes, chronic respiratory disease, arthritis, Alzheimer's disease. These conditions may not spread person to person, but they have far-reaching public health consequences. The burden of chronic disease. Chronic diseases are the leading causes of death in most developed countries, and increasingly in developing ones. They account for about 70% of deaths globally, a large portion of healthcare spending, significant loss in productivity and quality of life. Most chronic diseases are influenced by modifiable risk factors, making them an essential focus for prevention. Common risk factors. The first is tobacco use, which contributes to cancer, heart disease, and chronic lung conditions. The second is poor diet, especially diets high in sugar, fat, and sodium. The third is physical inactivity, which increases risk for obesity, diabetes, and cardiovascular disease. The fourth is alcohol misuse, linked to liver disease, cancer, and injury. The fifth is environmental exposures, including pollution and occupational hazards. Addressing these risk factors can prevent or delay many chronic diseases. The epidemiologic transition. As countries develop, their major health burdens shift from infectious to chronic diseases. This is called the epidemiologic transition. In early stages, infectious disease and malnutrition dominate. As life expectancy rises, chronic conditions take over. This shift creates new challenges. Longer lifespans mean more years with disability. Health systems must focus on prevention, management, and long-term care. Understanding this transition helps guide global health strategies. Surveillance of chronic disease. Monitoring chronic disease involves tracking incidence and prevalence of conditions, risk factor trends like obesity or smoking rates, mortality and years of potential life lost, quality of life measures and disability rates. Major sources include national surveys like BRF1Ns, cancer registries, hospital discharge data, electronic health records. Good surveillance supports effective planning and resource allocation. Prevention strategies. Chronic disease prevention happens at three levels. The first is primary prevention, which aims to reduce risk before disease occurs. This includes health education, tobacco control, and vaccination. For example, the HPV vaccine for cancer prevention. The second is secondary prevention, which detects disease early to reduce severity. Examples include cancer screening and blood pressure monitoring. The third is tertiary prevention, which focuses on managing established disease to prevent complications like diabetes management to avoid kidney failure. Together, these strategies form a comprehensive prevention framework. Health disparities and chronic disease. Chronic diseases do not affect all populations equally. Disparities exist in race and ethnicity, socioeconomic status, geography, education level. For example, Black and Native American communities often face higher rates of diabetes and heart disease. Addressing chronic disease means addressing social determinants of health and ensuring equitable access to prevention and care. Let's recap the key points about chronic disease epidemiology. Chronic diseases are long-term, non-communicable conditions that cause major global mortality. Most are influenced by modifiable risk factors. As countries industrialize, they shift from infectious to chronic disease burdens. Effective surveillance tracks disease trends and supports action. Prevention strategies operate at primary, secondary, and tertiary levels. Equity must be central to chronic disease prevention. Epidemiology provides the tools to understand, prevent, and manage these conditions, improving lives across the lifespan. Thanks for watching. In the next chapter, we'll explore clinical epidemiology and how population-based science supports individual-level care decisions.